Hi, I'm Dr. Shane Howell with Alternative Health Management. I'm a chiropractor in the west side of Houston at a clinic uh, just south of I-10 near Belly 8. And with me is one of our staff members, Danielle, and I'm going to demonstrate, actually do an adjustment on her using a technique we use called activator methods. So Danielle has explained that she has a little bit of back pain. So why don't you turn around and just show, kind of point to where most of your issue is. Okay, so that's kind of where the lumbar meets the sacral area. So this is essentially how we do an adjustment, and so you understand what it looks like, how gentle it is, things like that. So coming up to the table here, and there's a little foot pedal down there that she's going to step on. I'm going to get a little paper for hygienic reasons. Going to lean against the table. Okay. I'm just going to come around and push a little button here. The table's going to lie down for her. I call it the lazy man's table. But it's great if somebody has a really hot back where there's a lot of back pain, and just moving around is very painful. So first I have the patient just take a couple of nice deep breaths. So take a couple of nice deep breaths. It just gets them relaxed. I want you to relax your legs, your knees, your feet. Okay. With activator methods, we use a little instrument. It looks like this. This is the most advanced one, the Activator 5, which is all electronic, basically, and gives us a very standardized form of adjustment force. So I'm going to come up to the table, and I'm just looking at if there's any kind of more overt imbalances, if she's higher on one side or the other, pelvis is on one side or the other, or anything like that. The first thing I do is I'm push the legs together and just see, I'm looking at how even it is. So come on over here and you can see directly over the top. You can see how there's a little bit short on the right side. Okay? And just go ahead and step back. And so I'm going to bring it up. Okay? And so that's a typical pattern where it's short, and when I bring it up, and this is, we call this position 2, it kind of reverses itself, and so now it's longer. So I want to find out, okay, where is that coming from? It's either coming from the knees and the feet or the pelvis. So I just kind of provide a little pressure on the inside of that right knee, inside of the left knee, outside of the knee, outside of that knee. I'm just looking for it to go from short to then even. And I come up to the pelvis on the opposite side and just kind of pull a little bit, just gently. Still no change. And then I come up, the muscles on the back are just followed up to where the bottom of the pelvis is. Just provide a little pressure, and that evens it out. Okay, so that gives me an indication of where I need to adjust. So I come right up, and I explain right where the hamstrings connect with that little bone that people sit on. Adjust there, just inside of there on the sacrotuberous ligament, and then right on the crest of the pelvis. Now it's even. Okay, and then I have her squeeze her knees together, relax, let go. That's checking the integrity of the pubic bone where the pelvis meets in the front. Now put your right hand behind your back. And this is looking at, when I have her do this, first thing that has to happen is the core muscles right along L5, the lowest lumbar vertebra, are moving and working with that. So if it's not moving well, then the pelvis has to compensate for it. And I'll get a short leg, and I do. Okay, so bring your arm down. Right at L5, I'm going to adjust that. So come right across the pelvis. That's about L4. Just below that is L5. So it's a little rotation on the right side. So let's recheck it. Right hand behind your back. now it's nice and even. Okay? That's the beauty of the activator methods technique, is that I know exactly where to adjust and where not to adjust. And then I can recheck it if I did get it. Bring your arm down by your side, left hand on your back. So I'm just kind of work my way up the spine. Nice and even at L4, okay? Both hands behind your back. Jump up to L2, and there's a little rotation there. So bring your arms down by your side. So I can use the same technique to find L4 and then count up to L2. A little rotated on the right, meaning that vertebra is kind of twisted and it's not moving more to the right side. Okay, both hands behind your back, and we'll recheck it. Looks good. Both hands down. Put your right hand above your head. And see, this is where the lat muscle connects all the way to the arm, all the way down to the lower back here, right about T12. So when the first thing has to happen, it has to stabilize here so your body can do that. That looks nice and even. Good. Both hands above your head. And work up to the 8th thoracic vertebra, which is, if I go, and that one's a little rotated, the scapula, or the shoulder blades, right at the bottom of it, that comes straight across, that's T8. A little rotated, and see, then since they have the ribs, if it's rotated on one side, then the rib on the opposite side kind of pulls out a little bit. Okay, looks good. Both hands down by your side. Turn your head to the right. Looks good. That's T4, the 4th thoracic vertebra. And I'm going to lift your right, go ahead and lift your right shoulder. Back down. Looks good. Okay. Shrug both shoulders towards your ears. Relax. Shrug your shoulders up and then pull them back. Relax. Back down. Good. So that was looking at the 1st thoracic vertebra and then the rib, the first rib. All those look good. Okay. Squeeze your arm into your side. Relax. Squeeze your left arm into your side. Relax. And that's just looking at the scapula or the shoulder blades moving in or out, if they're moving well. Turn your head back to the center. That's looking at the bottom of the neck, called the 7th cervical. That looks good. Lift your head and look up. Back down. And that's C5, or the 5th cervical. That's a little rotated on the right side. And that's about right where the crease in your neck is. Okay. Lift your head and look up again. Back down, just rechecking. Good. Okay. Tuck your chin to your chest. Relax. Back to the center. A little bit of tension on that 1st cervical vertebra, and this usually shifts side to side. So that's right where the skull meets the neck. I'm just going to kind of move her hair out of the way a little bit. Just relax back and center. There you go. Come right off behind the ear, there's a little bone, and just below that. Okay, nice and gentle. Press your face into the table. Relax. Good, looks good. So that is the basic activator methods adjustment. Now if somebody had a lot of problems with their shoulders or maybe problems with their knees, there's very specific little isolation tests we do with that to check that. For instance, I find a lot of runners and things like that with knee issues, they'll have what's called a lateral patella, where the patella, the kneecap, is wanting to kind of pull out, and so that the quad muscle and everything gets a lot of tension on the knee when they run, and so we'll find that. Or with a lot of people with shoulder issues, I'll find a little rotation in the glenohumeral joint, rotator cuff, so it's a little kind of torqued inward like that. So because we spend too much time on our computer or driving or on our phones and stuff like that. It's a lot of rotation. So there's adjustments we can do for that. And then what I usually do with a lot of my patients is I'll use what's called the vibrocursor, which is a pulsating trigger point massage. And I can kind of work out the tissues working up to an area of complaint. For instance, if somebody has low back, like Danielle complained of, I'll work through the feet, the calves, hamstrings up, because tension in here where that muscle is not functioning properly, since it's all connected, will affect the back. And just because somebody has back pain, that may actually not be the source of their pain. It may actually be coming from some trigger points and tension in the calf or the hamstring or the ITB or somewhere like that. So I want to kind of rule those areas out and get those worked out. Also, when I do this, I kind of make note of it, and I'll usually give my patients a little chart and mark those areas so they can work on them themselves, either using a foam roller, a lacrosse ball, or some kind of roller in some way, kind of doing their own self-massage. And then usually when I'm done with that, I'll bring the table back up. Just make sure everything's functioning properly. And what, like just for everybody here at home, I'm gonna ask Danielle, did any of that adjustment hurt?
No.
That wasn't painful at all?
No,
Okay.
not at all.
So we adjust, obviously, we adjust little kids, we adjust elderly. I've adjusted people in their 90s. I adjusted my own kids since they were 2 days old. So it's a very safe technique, very precise technique, because one of the important aspects of activator methods is that you know where not to adjust. So if you have any questions, just give us a call at 713-722-2580, and we're here on the west side of Houston. We're waiting for you to come on in. Take care.